These are the HIV absolute must-knows. So if you are studying medicine, going to study medicine, or you're in medicine, these HIV must-knows are things you just have to know. Doesn't matter if you're a doctor, nurse, or any other medical professional. There's too many people that don't know the absolute basics, so I'm just going to give you the absolute basics now. And so if you're a doctor or a nurse and you don't understand much about HIV, and a HIV patient comes into your A&E department or emergency department, what do? So if you know they've got HIV, you know they're on medication, you know their viral load is undetectable and their CD4 count is normal, then chances are the reason why they're in the emergency department has nothing to do with their HIV. Okay? There's always a few exceptions, but the vast majority of the time it's got nothing to do with their HIV. Turning that around though, if someone with HIV comes in who they know got HIV, they're not taking their medication, so they've got a detectable viral load and the CD4 count is quite low, then the chances are they're in hospital because of their HIV. Another few important things as well, just because someone's got HIV, they don't need to be in a side room. The only reason why someone needs to be in a side room is if they've got a condition which means infections will kill them. So for example, cancer patients or transplant patients who may be neutropenic, or alternatively, someone who has open TB. So in other words, communicable or contagious diseases. HIV is not that type of, it's not a communicable disease, it's a sexually transmitted infection. And so HIV patients per se do not need to be in a side room. Another thing as well, for anyone who is going to be a surgeon out there, if someone's got HIV, they do not need to be at the end of an operating list, especially if they are undetectable and they're taking their medication. If you think about it, a lot of your patients, if you're a surgeon, won't know their HIV status, and you don't check HIV status in all your patients. And so if you've had quite a few years of operating experience, chances are you've probably already operated on a patient who's HIV positive and you didn't really know about it, and there was no special precautions taken for that individual at all. And so just because you know someone is HIV positive, they do not need to go at the end of a surgical list, and they are treated exactly the same as everyone else. For individuals in A&E or obstetrics and gynecology, a HIV positive female can quite easily and usually has HIV negative babies. And all the pregnant women I have cared for over the last few years have all given birth to HIV negative babies. It's actually quite rare now for women to have HIV positive babies. And so it's very important to get that message through. This is one way of how we'll be able to get rid of HIV for the long run, to ensure that mums have HIV negative babies. Added to this, a very, very important aspect of HIV is if you are undetectable, you cannot transmit it to other people. So if you're undetectable, it is untransmittable, and that is where the phrase U equals U comes from. Undetectable means untransmissible. How do you become undetectable? You take the medication on a daily basis, and you keep on taking it until you become detectable, and then after a few months, some say 6, some say if you're undetectable, you can't transmit it. I think there's a safety lag in medicine in the UK that we prefer to say 6 months of undetectability before it's untransmissible. But at the end of the day, if you're undetectable, you're untransmissible. These are the main points of HIV I wanted to cover for any general medics out there who may not be necessarily up to date with the latest on HIV. So see you in the next episode. Take care. Bye-bye.